The greatest healthcare failure in the world happening in the richest country on earth. Health problem will hit you or somebody you love, unfortunately, guaranteed. And here's the uncomfortable truth. Even the people who support the monopoly, the one who defend it, protect it, expand it, one day they too will get sick, and their child will, or their parents will. And in that moment, the system they supported will show them exactly how broken it is. I've seen this cycle with my own eyes. I know entire leadership teams, powerful, influential people who spend years making the monopoly even bigger. Then suddenly they were pushed out. Done. And just like that, they were sitting in the waiting room like everyone else, fighting to get decent insurance, fighting surprise bills, fighting the same machine they helped build. That's when you realize the problem is bigger than any individual. It eventually swallows everyone, even its own architects. And this is why we are not enemy. Everyone inside and outside the monopoly must be part of the fix. Because a broken system hurts everyone and a functional system benefits everyone. Let me admit something. For years, I was feisty, angry, loud, explosive, furious at the people inside the monopoly. Insurance staff, administrator, management company, every middleman in the galaxy. I blamed them. I treated them like they are the problem. But as I dug deeper, I realized something humbling. Most of these people aren't villains. They are victims of the same system. Even if they are making good money today, they are trying to do their job, support their family, survive inside a structure they didn't design and cannot change. Even they will eventually be hurt by the system when illness comes for them or somebody they love. So I stopped blaming individuals. I stopped fighting people and I redirected my fire toward the true enemy, the system, not the worker trapped inside it. This movement is not against people, it's against any architecture that fails all people. Why my perspective is different and why it matters? Before I ever become a surgeon, I started my career doing family practice in Tunisia, in north of Africa, the pure unfiltered front line of medicine, face to face with family, suffering, access issue, and the real meaning of healthcare. And then I crossed the Mediterranean first and the Atlantic after, trained again and become double board certified in France and the United States. Three continents, three systems, three philosophy, three ways of valuing human health. I've seen medicine from the trench of family care, from the high stakes world of surgery, and from inside and outside the system. And that gives me a rare vantage point. Inside the machine, outside the machine, above the machine, and hear the truth. You don't need three certification or three continent to see the problem. Common sense is more than enough. The incentives are backward, the pricing are absurd, the solutions are obvious. It's the system begging for common sense, and that's exactly what this movement brings. This is the American paradox, the tragedy, and the opportunity. Let's speak the truth loudly. America has the best medicine on earth, period. No one of the best. No. The best. The number two is not even close. We have the best surgeon, the best training, the best doctor, the best hospital, the best technology, the best outcome, and the world knows it. Countries send their most hopeless cases here for the American medicine, they perform miracle. Others won't even attempt. And yet, we also have one of the worst access system in the developed world. It's a NASA level medicine with a medieval level pricing. This is not a medical failure. It's a system failure. Fix the price, make it transparent, fair, predictable, and the United States will become the global capital of medicine, unlocking $1 trillion medical industry overnight. We don't just help Americans, we lead the world. And as a surgeon, we have the moral duty. We fix what is broken. That's literally our job. How can we stay silent while the entire system is broken around our patient? We fix people every day. Now it's time to fix the structure that surrounds them. Make no mistake, this is a national economic threat. Medical debt is the #1 cause of bankruptcy in America. A nation cannot lead the world if its own citizens go bankrupt for surviving an illness. This is unsustainable, this is immoral, and this is un-American. The silent majority is with us. Millions of people, patients, nurses, independent doctor, small business, all know the system is broken. They are the silent majority. They are waiting for someone to lead the movement. You know, we have a generational responsibility. If we don't fix it this now, our children will inherit a healthcare nightmare they didn't create. We owe them better. And you know what? This movement will succeed, and I'm convinced. Not because I say so, but because the truth is on our side. The math is on our side. And finally, the American people are on our side. Patients, doctors aren't enemy. We are victim of the same machine. One pays too much, the other gets paid too little, and the middlemen walk away with the treasure. That ends here. Transparency is our weapon. Because once prices are public, the monopoly loses its superpower, its secrecy. Fix the price, and American medicine exploded into the world stage, the way it should have decades ago. I lived this with my own brother's illness. The quality is there, the access is broken. I left the monopoly, I built an alternative that works. Now I'm inviting America into the blueprint. One surgeon alone, powerless. 10,000, unstoppable. This is my mission, this is my plan, my curse. And yes, please don't laugh. I'm dead serious. The chance of success is small, but the chance of not trying is zero. I will change this system or I will die trying, literally. If this raises your blood pressure, don't call your cardiologist. Just join the movement. Drop your email. Stand with us, because when your family or their family needs care, everyone will be grateful. We build a system that heals instead of destroys. Expose, resist, reform healthcare. Let's fix this together. This is Dr. Ben Maurer, and above all, you stay healthy.